everyone, welcome to my page, to my world. Is your wellness pretty? How you guys doing? It's been a while, eh? I'm sorry this video is coming later than expected. I remember the last post I made on infertility. I said I was gonna post just the next day. But yeah, man proposes and God disposes. Life happened. I had quite a hectic weekend, and so I just couldn't make a continuation of the video like I promised. I'm sorry. I hope to do better next time, okay? Otherwise, how are you guys doing? I'm sure you are well. Yeah, so today I'm bringing us a continuation of the topic we discussed last time. If you've not seen that video, please go watch the video on infertility part 1. And in that video, we talked about what infertility is, then a few steps you can take to achieve pregnancy, and then we talked about the types of infertility, which are the primary infertility, the secondary infertility, and the unexplained infertility. So today we are going to be talking about just a continuation of infertility, and then we'll talk about the symptoms of infertility today. We'll talk about the risk factors or predisposing factors to infertility as it affects both the male and the female. And then we're going to specify the causes of infertility, specify both the female infertility and the male infertility. Okay, so yeah, let's go. So I said we're talking about today the symptoms of infertility. The major sign of infertility is not getting pregnant, despite a regular unprotected sex. You are still not able to achieve pregnancy naturally. It's just struggle. So that's usually the symptoms. Some persons do not have any other symptom apart from not being able to get pregnant, while some can have a few physical symptoms like pelvic or abdominal pain, or both. Okay, and then for the female, you can have irregular vaginal bleeding, irregular menses, or no periods at all. Irregular vaginal bleeding, irregular periods or menses, or no periods at all. And then the men can have some penile dysfunctions. Example of penile dysfunction is priapism. It means stiffness of the penis, a rigid erection, a stiff or rigid erection, usually experienced by people that have the sickle cell disease. Not them alone, that is just one out of the numerous causes of priapism. Then it can also be like balanitis. Balanitis and inflammation of the glans penis. That cap-like part of the penis. Yeah, when it's inflamed, it's gonna make you have painful erection and you'll not be able to penetrate. Yeah, Then also the Peyronie's disease. Okay, Peyronie's disease is just like scar tissue formation on the penis. Scar tissue making you have painful erection. Then sexually transmitted infections also is one of also a penile disorder, okay, as it relates to the men. So now you must know also in notes that 25% of couples experience more than one actually. They have more than one of the numerous causes of infertility. Usually have just 25%, I don't mean get my percentage, yeah. 25% usually have more than one of the numerous causes of infertility. And that now brings us to the risk factors as it affects the male and the female. Yeah, one of the risk factors to infertility is your age. The older you get, the more your fertility age also reduces, both for the male and the female. Then also hormonal imbalance can be a cause, a predisposing factor rather. Eating disorder. An example of eating disorder is anorexia nervosa or bulimia. Anorexia nervosa simply means not wanting to eat at all. Some persons just get scared of food. They see food and they get scared. Those models, they don't want to pick up weight, so you see them running away from food. Some models, some are just like that. They naturally don't like to eat. Even when you force it down their throats, they go out there, poke their hands into their throat and just bring it out. So people like this are usually underweight and malnourished. Of course, they're not taking in the nutrients they should take in, and so they'll be malnourished. Why? For those that eat too much, the bulimia, they eat too much, so they are overweight, if you get what I mean. Okay. And then like I mentioned also, I said pelvic inflammatory disease. Pelvic inflammatory disease is also one cause, yeah, predisposing factor. Over exercising, too much of everything is bad, okay? Yeah, so over exercising, radiation or chemotherapy for people that are on cancer treatment, for cancer patients. So radiation or chemotherapy is also one predisposing factor. And then chronic conditions and diseases, disease of the heart, diabetes, and all that. And then exposure to environmental toxins like pesticides, excessive alcohol consumption. I keep stressing on this. It's not enjoyment, it is detrimental to your health. Reduce the way you take alcohol. It's not only to the men, even the women, okay? Then also smoking and use of tobacco is also a predisposing factor. Substance abuse. Some persons are addicted to these energy drinks that are high in caffeine. They are high in caffeine and they do you more harm than good. Some persons just walk into the pharmacy and then they buy cough syrup that has codeine, and you just see them gulp it down. This is detrimental to your health. life is not just about now, but also about the future. When you are ready to settle down, you just find yourself struggling and maybe end up regretting this sort of life you lived in as a teenager. So why not take caution? Prevention, they say, is better than cure. Is better safe than sorry, my people. So this brings us to the causes of infertility as it relates to the female. The major cause of infertility when it comes to the female is ovulation disorder, ovulation problem. It's either you are not ovulating or you're producing poor quality of eggs. It's usually ovulation problems. Then other ones can be endometriosis, it can be uterine fibroid, it can be pelvic inflammatory diseases, it can be ovarian imbalance, it can be polycystic ovarian disorders, okay? It can be kidney diseases, it can be structural abnormalities of the vagina, the uterus, and the fallopian tubes. It can also be blocked fallopian tubes. It can also be surgical or congenital absence of the ovaries, irregular or absent menstrual periods. Your periods are not coming at all, or they are not even regular. Those can be a cause of female infertility. And tubal ligations. Tubal ligation. Maybe you once had ruptured what's this called? Ruptured ectopic pregnancy. So at times they just cut off your tube. That's saprophyrectomy. They cut off your tubes, or somehow your tubes are tied. Probably you're done having babies, or for one reason or the other, your tubes were tied. A tubal ligation is a way of sterilizing a woman. Yeah, so it can also be a cause of infertility. Then also genetic problems or chromosomal disorders, thyroid problems. Of course, you know the thyroid gland. Some of those persons, some female having this goiter, you see under your neck just gets swollen. That's called see swollen and all that is called goiter. So seek medical attention. Like I always say, if you don't seek attention, you wouldn't know what the problem is and you will not be treated right. So until you do the proper investigation, you will not get the right treatment. You wouldn't be taking the right steps in the right direction. There's no need just doing your trial and error. No. The earlier you see your gynecologist or your urologist, the better for you. The faster you will attain your goals. So with that being said, I think we're going to call it a day today. Then in my next video, I'll be talking about the causes of male infertility. For now, do have a great day. And remember, health is wealth. Ciao.